I'm going to take a deeper dive into what we're discussing today in following videos. But for right now, if you are a BCBA and you are running parent trainings or you're supporting RBTs in the home or in any way supporting families, and that family is discussing with you some problems that they're having with sleep, I want you to look at these 4 things first. So the first thing you're going to do before you start implementing or attempting to implement any sleep treatment plans or protocols to help remediate sleep issues or problem behavior is you want to interview the family. You want to get a good sense of what is happening in the home, where they're seeing any problem behaviors, what their concerns are, and what their family goals are going to be from this process. The next thing you're going to do, and this is kind of attached or really attached to part 1, is you want to identify if there's any routine that the family is currently engaged in leading up to bedtime. What does the routine look like? What elements are in play during the routine? Where does that routine occur, and how much time does that routine take them? In addition to this, you're going to get a little bit of a better sense of what problems are occurring during the routine. Where does the family say that they're seeing hiccups, or where does problem behavior live in the routine? As BCBAs, we're always looking for the triggers or the antecedents. Help the family start to identify those for you so you get an idea of what the night looks like leading up to bed. So the third thing that you're going to do before you consider starting any type of treatment plan while you're still interviewing the parents is identify where that sleep space is going to be. Do they even have a sleep space, and where is it? Where is it in the house? But also, who sleeps with the child, if anybody sleeps with a child? Do they share a bedroom with a sibling? Do they share the bedroom with the parents? Do the parents sleep in the child's bedroom? Do they fall asleep on the couch and then they get moved? So where is this child going to sleep? And if they don't have a consistent sleep space, find out in this conversation where the parents have identified that they would like their child to go to sleep. So in the conversation about the sleep space, you're going to also identify with the parents if there's any problems with the space. So what is it like at night, noise-wise? Is there a lot of noise from the street, from the house? What is it like in terms of light? Is there a lot of light that pours into this bedroom? Hallway light that goes on? Is it near a sibling's room and there's a lot of activity in the sibling's room because maybe they're a teenager and they're up later at night? So try and figure out and identify with the parents what barriers are to the current sleep space that they are using or that they need to be or want to be using. You're also going to ask the parents a little bit about any resistance to the space. So get an idea of, does this child spend any time in this sleep space currently? What does that look like? Are they resistant to the space? Do they like to hang out there? Is it something they're trying to avoid? You want to get all of this type of information from the parents during this conversation. So the fourth thing you want to find out before you're ever starting anything is this child on any medications? Are they taking melatonin to help go to sleep? Do they have a sleep aid that's prescribed by the doctor? Are they on any type of other medication for things like problem behavior or focus? What are they taking? And when are they taking these medications? The other thing that you want to get a better understanding of is, what is the impact of these medications on sleep? So this will be a larger conversation, but for now, just find out what they are currently taking. So those are the 4 main things I want you to think about and discuss with the families before you start heading into the potential for treatment planning. But then I also want you to have 2 more bonus concepts. So the first one is, have a good understanding of the child's leisure skills. And when I say leisure skills, not only what they do to occupy themselves, what do they do when they are spending time just enjoying themselves, but also what do they do to keep themselves in a calm state, or what type of skills do they have that promote calm. This is going to be important later on when you're developing a bedtime routine. So you want to have a good understanding of what skills or what activities they engage in, how much support do they need during those activities, and how much time do they spend in these activities. My second bonus tip is going to be, get a good understanding of skills that support sleep. So I talk a lot about relinquishing, matching, following directions, transitioning. These are all skills that if the child or the learner is struggling with in general, they do have an impact on how they can approach sleep and approach bedtime. So we want to get a good understanding from the family, maybe the school or the technicians working with this learner, as to how proficient they are in any of these skills. And then we're going to talk in other videos about how to increase that proficiency. So there you go. 4, actually 6, things to consider before you're starting a treatment plan. Stay tuned for following videos. Please subscribe if you found this helpful, and see you in the next one.